Up next, we have a video address from member of the European Parliament, Nikos Papandreou, who is from Greece and is with the Socialists and Democrats group. His presentation is titled From Policy to Practice, How Europe Can Deliver for Lung Cancer Patients. Let us hear from him.
Dear colleagues, thank you very much for the invitation to give my contribution like this to the opening session of the Lung Cancer Europe Conference 2026. I am Nikos Papandreou, and I'm a member of the Health Committee of the European Parliament from the Socialist and Democrat Party from Greece. With our help, we aim to improve outcomes and quality of life for all individuals and families of those affected by lung cancer. Everybody knows better than I do that cancer is very complex, and we can see it from many angles. The thing that I'm focusing on especially is preventative medicine and screening. I'm very interested in how the European Union will do the screening. Recently, in the port city of Piraeus, a working class area of Greece, I brought a liver scan to check for fatty liver, and those were pre-indications of cancer, and unfortunately the results were not very helpful. 40% of the ones that we measured had to be sent to a hepatologist afterwards. Our focus at S&D is healthcare for everybody, access for people, early diagnosis, consistent quality of care, and to address each patient regardless of where they live. That typical saying, your healthcare should not depend on where you live or your P.O. box number. We're also working very hard with our new rules to improve the speed that therapies come to the patient and thus improve the survival rates. And of course, my role is to convince the various ministers of finance who pay for the therapies to include as many as they can in a smart way within the National Health System Reimbursement Program. European policies also focus on the aftermath, so we look at the patient journey. And there, the role of the patient advocacy groups like yours is crucial. I have learned very much from talking with Cancer Europe and other such organizations, and I would really like them to be more institutionalized, to be included in the health systems. In some countries they're more active and allowed, and other countries not so much. So we also need to create, and we are creating dashboards to hold institutions accountable to implementing cancer plans and policies. Even though we cannot force certain rules on every member state, we can certainly push them by advertising where they're behind the average of Europe. So for me, that's very important, the political pressure that we can put on member states to ensure that they're keeping up with cancer policies. And as I said again, screening is top of the list. The screening will improve efficiency, both in time and resources used to achieve common goals. We also want governments to be aligned with healthcare providers, researchers, patient groups, and in the end, a holistic assessment behind each policy. We believe in shared knowledge. We know that develops healthcare systems at a faster pace, enabling each member state to play its strengths to achieve a common result. Collaboration is crucial for something that we're pushing very hard, cross-border clinical trials. We want all the countries to be involved, and of course we need patients from different countries so we can have greater access and quicker treatment for those patients. So I think your role is to push for equal access to screening and treatment across Europe, to raise awareness about the conditions which lead to cancer. And that is very important. Returning again to the Piraeus example, the reasons for the liver fattiness, you know better than I, are often having to do, besides DNA, having to do with lifestyles. And this was a working class area where the lifestyles are traditional, there's not much exercise, there's lots of fatty food. Unfortunately, in Greece today, we have ultra-processed food and we have lots of alcohol. I'm also very active on the anti-alcohol advocacy because that's been proven that it's a problem, and I'm one of those who would even like labeling on alcoholic beverages to put that little sign that they put on cigarettes that says, this might lead to cancer. We need to get people to reduce their drinking, and I'm not an expert in it. I have a Greek habit, but I've certainly reduced it ever since I've joined the Health Committee. So good luck today with your conference. I wish I could be there, and I'm sure we'll have good results, and I will follow up and follow them up afterwards. Thank you very much.